and welcome to In the Cool of Today, and today's segment of People Connecting People. I'm your host, Ruth Pegaron, and I have a special show for you today. My guest is a healthcare operations leader with a passion for serving aging and various populations through the PACE model. He has over 8 years of experience across center management, expansion, strategy, policy development, scaling programs across state lines, and building foundational systems from the ground up. He is committed to elevate healthcare systems that serve different populations with dignity and respect. So please welcome to the show today the Regional Director of Virginia Operations for Cherry Blossom PACE and Treasurer of the Virginia PACE Alliance. Please welcome Ronald Hess. Well, thank you so much, Ronald, for being here.
Of course, it's my great honor.
Yeah, I love when you say from the ground up. That's very, very important.
Yes, of course, of course.
It is. But before we get into that, tell us a little bit about Ron.
Sure. So I am Ron.
Okay.
I serve, again, as the executive for the Cherry Blossom PACE operation. I don't want to say an avid gardener, because that implies that there's a level of skill.
Yes.
But I am an enthusiastic gardener.
There's a big difference.
Very big difference, yes.
You're on your way to skill.
Sure, sure. That's a very kind way of putting it.
Yes.
I do love growing flowers in particular, love my sunflowers. Not great, again, at the upkeep of them, but love them all the same. This is one of the rare days that I'm actually not decked out in a full floral getup, so it's a rare day for us.
It is rare, and I guess this is your time of year.
Yes, it is.
Okay,
yes,
that
indeed.
you really enjoy it and like it.
Sure.
For all the flowers, it's beautiful, and the rain is very helpful.
Yes.
Through your gardening time. Okay, well, thank you, Ron. Thanks for sharing. And now we'll get into a little bit about PACE and what you do professionally, and telling us all about PACE. But before we get into PACE, tell us what PACE means.
Sure, sure.
So what is the acronym capital P, capital A, capital C, and capital E? Please tell the audience what is PACE.
Yes, so PACE is the Program of All-Inclusive Care for the Elderly, and it does exactly that. Comprehensive healthcare package, service that can keep seniors in their homes, allowing them to age in place through a bunch of supports that we put forth to keep them happy, healthy, and aging with dignity. Okay,
and Cherry Blossom is the name of, a little history of Cherry Blossom. It's just the name of PACE, right?
Correct, correct. So Cherry Blossom PACE is one particular program within the Alexandria area, serving Alexandria, Fairfax, and Arlington, but PACE as a concept actually expands nationwide, so it is a nation-based program.
Oh, got it. So tell us a little bit about the history, or what inspired PACE to even get started?
Sure. So it comes from humble roots, as all good healthcare programs do.
Yes, yes.
It actually started in the 1970s, early 70s. And it happened in San Francisco, California, when a community of families who had aging family members wanted to come together and think about healthcare a little bit differently. So at that time, of course, the typical option for senior services was a skilled nursing facility. And many of the members of the community decided that that didn't quite align with how they wanted to see their care instituted. They much preferred a family environment that allowed them to stay in their own homes, where they've built their families, where they have their memories, you know, all of those different pieces. And so fast forward to where we are today, we see PACE has expanded across almost the entire nation. There's very few states that actually don't have a PACE presence, and each year we're seeing more and more of the PACE programs start to pop up and provide these excellent services for seniors.
In your own words, tell us a little bit about PACE in your words, and then why did you join PACE?
Sure. So PACE, in my own kind of thinking, it's a really innovative, outside of the box approach to healthcare. So there's all these services that a PACE program can provide. We've got providers, we've got nurses, therapists, social workers, you know, all kinds of people who are very highly specialized in the aging population. And they all come together and they try to construct packages of care to keep people in their homes. So we have to think about care always very, very differently. We're constantly challenging one another to come up with different perspectives and come up with innovative ways that we can provide these types of services for our seniors. How I became involved in PACE was actually a happy accident. So I had applied, thinking that I had applied for a nursing home position, happened to be brought in on this wonderful PACE benefit, fell in love with it, and I have not looked back since. I truly think this is a revolutionized model that is the future of healthcare.
Oh, wonderful. I love those happy accidents.
Of course.
Because you don't know your passion until you get your passion sometimes.
Absolutely.
And then once you get it, you're like, yeah, this is me. So I'm glad that you found it. And then as far as the benefits, tell us a little bit about unexpected benefits that people can get, because this is a very interesting model that people aren't used to probably.
Sure.
And it sounds great. So tell us a little bit about unexpected benefits that people get.
So sometimes PACE as a model can be a little bit expansive, right?
Right.
And it can be a little overwhelming to understand, like, what are all the different pieces that come together in this package. Some of the unexpected benefits, though, that we provide to our seniors, we have, meals that we're able to provide. We are able to assist with grocery, bringing groceries into the home, assistance with bathing, assistance with caregiver support. The unspoken heroes at the end of this story are always going to be the caretakers who are involved in keeping mom and dad safe, our neighbors safe. So providing the supports for them is also a major, major added benefit. And outside of just the coordination of care, we physically will facilitate care by our panel of qualified specialists that we employ.
Oh, wow. Now, here you use the word seniors. Is there age qualification for PACE, or?
There is.
Okay.
There is. So our requirements for the regulation is that we can serve individuals who are 55 and older and who meet other kind of state-specific regulatory requirements, medical qualifications, and different things. But that process itself is relatively simple. We assist every step of the way, and when someone becomes enrolled in our program, we often see that they maintain their enrollment with us all the way through. So.
Well, that's a great segue, because I was going to ask, once enrolled, what does it look like for someone that is a part of PACE?
Sure.
Yeah, as far as the services go.
So a day in the life of a PACE participant is going to look a little bit different person by person, because of course we have these very highly customized care packages for our aging population. So rule of thumb, I would say someone's going to wake up in the morning, they may have a home care aide in their home, helping them to get out of bed, maybe preparing breakfast for them, getting them prepared to get on the vehicle to come on into PACE. As soon as they arrive, they might be greeted by the registered nurse to do a quick check-in, make sure everybody's checking out and doing okay. Go to maybe the exercise group, exercising with their friends and their peers, sitting down with their friend group and having lunch. Maybe they have a prescription filled by the provider on site. Maybe they work with the physical or the occupational therapist. And then at the end of the day, they're sent home. They might get a follow-up call just to check in, see how things are going. How is that new medication doing for you? And while it's not typical, we also have after-hours emergency services that are available 24 hours a day, 7 days a week.
Wow.
So when that crisis moment comes up, or that burning question about this medication starts to come up, you're always going to have a nurse at the end of that line that's able to answer those questions in real time.
So I heard you say earlier in our conversation, you talked about being in the home and bathing and even groceries, and then I heard you say they come into PACE. So this sounds like you have a building that people can come to as well. Can you expand upon that a little bit as well?
Of course.
It's not just a program, it's a physical location too?
Yeah, a little bit of both. So our program, primarily all the services, our interdisciplinary team is housed out of our particular PACE building. It's also home to an adult day program where people are able to come in, socialize. We have rehabilitation gym, we have a full clinic. So it is a kind of a comprehensive medical building. Now, some people come in quite regularly to the PACE program on site and receive their services there, but it's not a requirement by any means. And other folks may have preference to simply receive those services directly in their home. And so we are able to adapt and meet the needs irrespective of the setting.
Wow, that is really a great approach.
Mm-hmm.
And I heard you also say the van. So people can drive on their own, or a van picks them up, either way, or
Yeah.
how does that look?
Sure,
Or work?
both available to the
Okay.
participants. We have our own fleet of vehicles that will come out, bring participants into the PACE program, bring them to appointments, bring them to any IDT or interdisciplinary team authorized location. And some folks do have preference to just have, a family member drop them off on their way to work. So we are able to meet those participants exactly where they are.
Wow, what a program. And can you just, for the audience and for myself, just explain an interdisciplinary team you've referenced?
Sure.
Just give us the definition of what that team is and how they kind of interact or work within the confines of the clients and the families and all of that.
Absolutely.
Yeah.
So the interdisciplinary team, or I'll probably refer to it as the IDT.
IDT, yes.
It's really the heartbeat of the PACE program. So it is composed of 11 different specialties that all come together, sit at a table and discuss daily each participant and anything that is changing. We're constantly revitalizing, refreshing, and coming up with new objective or new goals for our participants' healthcare. So this team really is what makes the decisions and the folks who will be providing the care hands-on for our participants. So all of the facilitation happens through that interdisciplinary team. And those are the folks who get to really be imaginative about what we can provide as a health benefit to our participants.
Wow. So if on the IDT team, is that right?
Yes.
So if one of your participants of PACE, say there's a particular, I guess, person on that team that they're not visiting with or have any issues to have to see that particular person, are they still a part of the conversation? So if something changes, they get to know?
Yes.
Okay.
Yes, absolutely. So all 11 of those disciplines, and they range from provider, nurse, social worker, dietitian, home care, transportation, just all of the different kind of elements of care. Every one of those people will be deeply, deeply involved in someone's, the oversight of someone's care, whether they have a direct role that they're providing or they're just advising and making sure that nothing changes. So I'll use the example of perhaps you have a client who comes in who's very deeply integrated already in the community. They have their church that they like to go to, they have a library that they love to go to, they have all these different supports that help them with kind of their activities day to day. The recreational therapist may not have a direct hand in facilitating activities for that individual, but they will be assessing and making sure that there's no changes, that there's no isolation. They don't suddenly withdraw from all of those services and require us to kind of reconstruct that package of services.
Wow, wonderful, wonderful, wonderful. Well, it is time for a short break, and we will return after these important messages.
Come on, let's build and draw and care. See, we can touch and taste and share.
Your reward for taking care of them is you get to eat them.
Come on, we can find all these gifts and more. It's our nature. Explore. Growing bodies and minds grow better when they connect with nature every day. Help the children in your life get out and grow. Visit Nature Explorer at arborday.org.
Welcome back. You are watching In the Cool of the Day, and today's segment of People Connecting People with my special guest, Regional Director of Virginia Operations for Cherry Blossom PACE, Ronald Hess. Prior to the break, we were talking about some of the different approaches to the IDT team, I'll say that. I just want to continue with that just a little bit. How does the IDT team work with, or you, or whoever's responsible, with local medical professionals? You know, if one of the participants may have a doctor not necessarily a part of PACE, is that a relationship that happens?
Yes, absolutely.
Okay.
So while our program is tasked with providing all the necessary care to allow someone to age in their own home, We can make that happen only by having all of the specialty, the specialists, the hospitals, and the pharmacies involved in the construction of those plans. So we contract out with our local hospital systems, our local pharmacies, our local specialists, and we make sure that we take the onus or the burden of, seniors might often have 5 different providers that they're going to see, each one prescribing this and that and follow up on this date, and it can become very, very overwhelming, right? And occasionally can become a little disjointed as well. So we work very hard to help facilitate each one of those specialists. So if, Mrs. Sue were to go over to the cardiologist and he wanted her to be seen by the ophthalmologist or the other ologist, we would make sure that we take all of those recommendations, that we have a response, and that we help to facilitate getting her to those appointments, any of the medications that might change as a result, and any other follow-up that would be necessary.
Okay. That's wonderful. Now, how does the IDT team interact when they see a change in a person? Or they just see, you talked about like the recreation person, when they see a change, like they're alerted, making sure these things happen. Because activity is important.
Sure.
Keeping people out and busy and walking and doing things, socialization, all of those things you hit on are so, so important. But there is a time, sometimes there is a change where you can notice a change. How do you respond to those kind of changes?
Sure. Our program is meant to adapt and is meant to age with someone. So the services are never stagnant, right? What you get when you first enroll might be different the first couple of weeks, the next 3 months, because it's going to evolve based on those needs. So our team is constantly assessing and evaluating and seeing if the strategies that we're putting in place are effective. Are they meeting the needs of that person? Are we making sure that we are obtaining the objectives of the caregivers, the families, everyone that's involved in that support? And then customizing and readjusting that care plan as necessary each and every time we feel that there is the need to do so. And
then I have a specific question too about memory care. So I know that's a very, very, very big topic and is very important.
Sure.
Because when you see a change in someone's mental status of decline, if it declines or anything like that, I know everyone is alerted. And number one reason you're alerted is for safety. So how do you handle memory or cognitive issues like with the memory?
Sure. So particularly with individuals who maybe don't have like family supports or someone who's immediately available in that house or in that family unit, we make sure that we provide levels of home care assistance. We have behavioral health specialists that are able to monitor for changes in cognition, able to monitor for changes in any type of behavior that would indicate that something is different, something is changing. And then we are able to act expeditiously to make sure that we are adjusting those services to meet their needs. Okay,
good. That's very important, and I know that would be important for a lot of participants if they solo agers. It's very, very big in this area. So to have that level of support is like the child I didn't have helping me out, or a lot of the children now live in other states, and mom or dad is still here or both, and you kind of like a big brother to them.
Sure.
Or big sister is what I'm hearing you describe.
Yeah, and that's such an important call out, because what we hear so often when someone enrolls into a PACE program, whether they have that natural family support available in the immediate proximity or not, is PACE really does become the second family for them. It becomes the fail-safe, and it becomes that extra blanket of protection and safety and security to be able to address those needs. Yes,
that is so important. So tell us a little bit about the hours. I know you have a physical building, and I know you're there for people. Tell us a little bit about the hours of the physical building, and then how do you interact with them outside of those hours?
Sure. So our PACE Center is open Monday through Friday, 8 to about 4:30. Closed on the weekends. However, care never stops in a PACE program. So we are constantly still facilitating transportation, appointments, and of course we have the after-hours emergency medical line for anybody who is going through any sort of a crisis or change in their day-to-day. They're able to speak with our team right away.
Okay, that's good. And then you said weekends, I'm sorry, weekends
Weekends, the center is
is
not open.
but they can still get transportation.
Transportation, appointments, and we still have medical professionals available after
wow.
hours.
That's wonderful. Because I could have, pickleball. That's a
Sure.
big deal.
Definitely.
That's a big deal for older adults now. That's keeping them very active. So I could have that on a Saturday and want to know, can you get me there? So,
Of course.
So you could be able to do that. Now, just talk a little bit about, mentioned about being a big brother, if you will, or that's safe. Would a family, like a parent themselves, contact you, or does sometime the children get involved and say, how can this program help, or how do you interact with getting someone enrolled?
Sure. So what we typically find is the people who are actively pursuing PACE services typically have approached a point of crisis, right?
Yep.
It's most often, it is that caregiver, it's the adult child of a family member, or it's the spouse of a family member who has, a full-time job, a family of their own to take care of, and then also these additional kind of increasing needs of their aging loved ones. And balancing and juggling all of that together, we often hear stories just feeling scared and feeling like there's just not someone in their court to help navigate all of those pieces. So one of the things that PACE is really designed to do is to offer that level of support to the families, to the spouses, to the caregivers, to make sure that they know that someone is in their court, that someone will help them to navigate all of the very complex pieces that are senior health care.
Okay, so you would help either one. Either if the parent themselves or the older adult contacts you, or a parent, and help them navigate through the process.
Absolutely.
So I know we're talking a lot about people being enrolled and being a part of. But is there ever a time when someone says, well, I don't think I need PACE anymore, and I'm good? Like, is there ever a time that kind of happens? Your program sounds really all-inclusive and you walk with people for years, but is there a time where people just feel like it's not, I don't need it anymore, basically?
Sure. And there's times people just feel like it's not the right moment, right? It's not the right time yet. That sometime in the future, this might be kind of the solution that we're looking for. But right now, things are okay, and that's fine. What I encourage anyone who has someone in their lives that's 55 plus that maybe struggles with just some of the basics of daily living. It could be, obtaining groceries. It could be taking, showers, or just getting up and out of bed. Ask those questions about, is PACE an option in this moment? Is this something we want to look at, or is it something we just want to learn a little bit more about to keep it in our back pocket? It's never a bad thing. Knowledge is always power.
Knowledge is power. And I'm glad you said that, because I would ask someone like you, you're so involved, how would you, or what would you say to encourage someone to not feel guilty? I find a lot of times too that, if some of those things you mentioned, not getting out the bed regularly, maybe a little groceries, or maybe just not active anymore, they've retired. And sometimes I found that an adult child feels guilty, if they call them for some help, because they feel like I should be doing that and I shouldn't have a life now, like my life is their life. How would you inspire them or encourage them to want to interact with some kind of support system like PACE?
Sure. The first thing and the most important thing is to know that you're not alone.
Okay.
That this is a shared experience with so many caregivers across the nation. And at the end of the day, it takes a village.
It does.
Senior healthcare is a very complex beast. Keeping track of the medications and of all the appointments and have transportation and making sure that, my daughter knows what the doctor said today while she was at work. There's so many pieces that go into that facilitation, and PACE is really built to help take that burden off of the caregivers.
So it's more of a partnership. Let's do this together.
Exactly.
And that frees you up, and that frees them up, and it gets them active again. And exciting.
We want to see our caregivers be able to kind of not have to be the middleman at the end of the day, to be able to resume the role of a family, instead of having to be that direct caretaker. We're able to help support that.
Oh, that's wonderful. All right, so we always like to ask a couple things before we close out. One is, what advice would you give to anyone that is either solo aging, retired, want to consider PACE, or just looking for other support, or any kind of advice you would want to give them? And then the second question would be, how would they, enroll if
Sure.
they were interested?
Sure. So, on that topic of
Right.
knowledge is power.
Yes, knowledge is power.
The most important kind of tool in the bin for our seniors is being able to look and see what resources are available. And sometimes that's way easier said than done.
Yep.
What I encourage in particular for, understanding more about this PACE benefit is easy web search just about PACE near me. It'll come up. There's plenty of platforms that exist to help identify which program might be able to serve. And learning more information about PACE, it doesn't require a specialist referral. It doesn't require a special invitation. And it's really non-committal. You're capable of reaching out, just learning more about what PACE can do, and then having that information always available. You never know. It could change your life, it could change your loved one's life, or it could change anyone that's involved in your day-to-day.
Wow, that was great. And then remind us one last time, what does PACE stand for?
Sure.
Yes.
The Program of All-Inclusive Care for the Elderly.
All-inclusive care for the elderly.
All-inclusive.
Well, thank you so much. It has been great talking to you, Ron. It's been awesome hearing about what PACE does. And I'm glad you were here. Thank you.
Thank you so much for having me.
Thank you. You're welcome. Well, it's that time again. If you have any questions about today's segment, please see the information scrolling below. You have been watching In the Cool of the Day and today's segment of People Connecting People. Thanks for watching. Bye-bye. See you next time.